Hi everyone, Dr. Patrick Lynch here, and I'm just here to go over some chart notes of a male in his mid 50s who I initially saw for the first time on January 12th of 2025 this year. This gentleman had said that his onset of symptoms were during and post COVID back in 2020. His memory took a dive back in 2020 and his symptoms escalated and gotten worse. His chief complaint was memory loss. He reported that he could not make any plans for 2 minutes ahead in his life. So his memory was so shot that he couldn't remember anything for the short term. In fact, his short term memory loss is so bad that he's reported that he could not make plans for 2 minutes ahead of time. This gentleman owns a business and he has approximately 15, 20 employees. And I don't know how he has been managing his business for the last 5 years, but he's been doing pretty well. So we're going to go over his chart notes and we're going to see exactly what really is going on. He reported that he thought that he had long COVID. So it's my job to make sure that it's either long COVID or it's something else. When I see situations like this, I want to know what else is going on. And when I am clued in with what else is going on, that gives me a perspective of what else he could be working with. Is this really long COVID, or did COVID weaken the immune system to the point to where it opened up dormant pathogen in the body that decided to come out and infect his body, causing an array of different types of symptoms? And if that's the case, what type of bug is it? So I'm an infectious disease specialist. I'm an autoimmune specialist. Infectious disease is what causes autoimmune presentations 99.9% of the time in my practice that I have seen. So basically, I got my eyes on bugs. I got my eyes on the potential for COVID weakening the immune system, letting out dormant pathogen, causing an array of symptoms. Then I need to look at, okay, what type of pathogen is this? And based on symptom presentations, you can find out what type of bugs that people are working with. So I'm going to share my screen here, and we are going to go over this gentleman's first initial visit. So here we go, and here we go. So this patient, I'm not putting down his name or his date of birth or his location for obvious reasons. I did get his permission, however, to share his chart notes. This patient is a 53-year-old male. COVID triggered his symptoms. I first saw him on January 12th. He reported having long COVID. Number two, he reported having symptoms since 2020. Three, he had a scan on his brain and they found a black lesion in his brain. Noted, black lesion. When people have a black lesion in their brain, that's generally automatically diagnosed as MS. MS is caused by a bug. It's caused by pathogens. And what type of bug? That's to be discussed further. So for some reason, he had felt like he had inflammation in his brainstem, basically in the back of his head in the occiput region. He had memory issues. He couldn't make plans for 2 minutes into the future. His short-term memory was basically not working. He forgot. This was later on when I said much better, or when he said things were much better. We'll go over his chart notes on February 9th as well to compare symptoms. So he forgets to breathe and he notices that he hasn't breathed in a while. And so that was one of his symptoms. He's had an ongoing headache since 2020. He had a pulsing vibration in the back of his skull with radiation around the back of his skull. He had a metal grinding sound in the back of the head to around the sides of the head. Also had headaches on feeling like there was a dome over his head, like a headache dome. He had hearing loss. The color in his vision would disappear. His vision would go from seeing color to black and white. He had thick saliva. He would hallucinate. He would dry heave for 5 minutes to an hour at a time, 2 to 6 times per week. He had sharp pains in the chest. He had sensations of shards of glass in the body. It felt like his body was on fire, either the whole body or part of the body. His body temperature didn't regulate as it should. The bottom of the body, the lower half of the body would be on fire, and the top of the body would be cold. He would have diarrhea with 5 different colors daily. He would have 10 to 15 episodes of diarrhea daily, yellows and oranges. He was never hungry. This person doesn't eat a lot or didn't eat a lot and has not eaten in 3 days. He has immediate nausea after drinking water. He reported that his bladder is killing him. Probably, my guess is burning pain in the bladder. He'll grab a sandwich, for example, and he'll bite his hand instead of the sandwich. His motor skills aren't working or weren't working very well. He had dry skin. He had intermittent joint pain that would migrate from one joint to another. He had regular nosebleeds. When he would blow his nose would bleed, as well as having bruises on the nose. He would bruise easily in different areas of the body. His coordination was not what it used to be. He had significant hair loss, severe anxiety, occasional drenching night sweats on the chest or knees down. He had little cramping in the calves, but has muscle soreness everywhere. He had gripping, aching pain in the chest region, but not often. He had ear pain and tinnitus. He had shortness of breath often, difficulty swallowing, acid reflux, but it's improved with Pepsid. He had episodes of tachycardia, skipped heartbeats. He had pain between the shoulder blades, between the back of the neck. This is quite common with people with chronic infections. All of these are common with people with chronic infections. Underneath the ribs on the back side and both sides, he had pain. He had serious pain in the abdomen. He had numbness and tingling in the limbs. His limbs would fall asleep to his elbows. He had slow urinary flow, and sometimes he would go to urinate and nothing would come out. He couldn't control his muscles to urinate. And when he felt like he had to urinate but nothing came out, he would defecate while standing. So he would lose bowel function when he was trying to urinate, and he would basically defecate in his pants. He had numbness and tingling in his feet and fingers. He had sharp shooting electrical like pains in multiple places around his body. He had hat head syndrome. When you go to take off your hat, it feels like you still have a hat on your head. So he had that. Nothing crazy, but something to be noted. He had quick muscle flaccidity. He had a full mouth of toothaches. He does not have teeth, but he feels like he has toothaches all the time. His energy is great until he goes to use it, and then he doesn't have any energy. He doesn't feel fatigued, but when he goes to use his body, he doesn't have any energy to use it. He has dull, achy pains over the left chest, angina-like pains potentially. He had center chest stabbing pain. He had internal vibrations. His sleep was insufficient. He didn't sleep well. He wakes every hour throughout the night. Every 2 months, he gets about a week of sleep. He has depression. He has a little bit of pain on the bottom of the feet. Same with the hands. He often cannot feel what he's holding. He cannot feel the fingers touching each other. He gets intermittent hives. He gets shaky. He gets into fight or flight mode. He has congestion. He has burning eyes. He has numbness and tingling in the face, head, and cheekbones. His low back pain and sciatic daily. He has burning pain in the groin and genitalia. He has bloating. And he has about 13 bowel movements on average with diarrhea every day. He has 13 bowel movements on average per day with diarrhea every day. Let's take a look at this. This, to me, looks like a case of chronic infections. No, this is not long COVID. Long COVID does not present like this. When we first started, I still consider COVID being part of it. And I treat him as if he has long COVID also, just to make sure that long COVID is flushed out of the body. And how do you do that? The way I do it is I consider Dr. Artis's protocol, in regards to 7 milligrams of nicotine patches every day for 7 days. And then I will use things like nattokinase and NAC as a means of treatment. 100 milligrams of nattokinase. And in this case, I did not use NAC because NAC in this case would make this patient worse with other chronic infections. We're looking at a chronic infection here. He has a black lesion in his brain. He has memory issues. And so, key symptoms that I'm looking at, this person has about 75 different symptoms, but I'm picking up a malarial pathogen. I'm picking up Babesia. And the reason why I'm picking up Babesia is because I'm seeing things like sharp pain in the chest. That's a Babesia type of symptom. Sensations of shards of glass in the body. That's also Babesia. Feels like the body's on fire. That can be Babesia and or Bartonella. So Bartonella is also another malarial type of pathogen. COVID is a malarial type of pathogen. COVID, according to Dr. Artis, is actually a toxin. Snake venom, nosebleeds, Babesia and or Bartonella pathogen, bruises easily, Babesia or Bartonella. So Babesia, Bartonella, these two pathogens, they get into the vascular tissue. And the spleen is also weak. And when the spleen is weak, then the integrity of the vessels are are shot. And so when people get bumped, it's easier for them to get bruised. Hair loss. Hair loss could be a malarial type of infection. And I say could, but it points to the possibility of that direction. So we're going to highlight it. And the reason why is because malarial type of infections get into the red blood cells. They consume our iron, oxygen, and hemoglobin. Iron becomes deficient. One of the first things that's going to happen with iron deficiency is hair loss because iron is needed everywhere in the body. And so the body starts to consider, okay, what's not needed so everything else can have its sufficient iron. And so the hair is not needed. And so then the hair goes, and that's one of the reasons why people can get hair loss. Doesn't have to be the reason, but it's something to consider. This patient has drenching night sweats. That's also malarial infection, Babesia and or Bartonella. Calf cramping, Babesia and or Bartonella. Typical symptoms of Babesia and Bartonella. Gripping, aching, pain in the chest region. Same, Babesia, Bartonella. Ear pain, tinnitus. Same, Babesia and or Bartonella. That could also be Lyme disease, Borrelia infection. That could be an array of different types of infections causing ear pain and tinnitus. But Babesia and Bartonella is one of those. Shortness of breath often. That is a classic malarial type of presentation. Air hunger, shortness of breath. So what's happening is the oxygen in the red blood cells are being consumed. And so when that happens, people have this air hunger. They're not getting enough oxygen. And so they have shortness of breath, they have air hunger, they're trying to get more oxygen because the pathogen is consuming the oxygen in the red blood cells. So that's why people get shortness of breath. And shortness of breath follows with anxiety. When people don't have enough oxygen in the blood, they get anxiety and they also get tachycardia. And the reason why they have tachycardia is because the heart rate needs to move what little oxygen it does have to everywhere in the body. When there's not enough red blood cells carrying enough supply of oxygen due to pathogenic involvement getting into the red blood cells, then the heart rate increases. So it can deliver what oxygen it does have everywhere in the body to keep the body functioning in the best way that it can. Difficulty swallowing, that's not necessarily, doesn't have to be a Babesia or Bartonella infection. Episodic tachycardia, definitely. Skipped beat, commonly. Pain between the shoulder blades and the back of the neck, underneath the ribs on both sides, serious pain in the abdomen. That's commonly Babesia. It could be anything, but commonly Babesia. Slow urinary flow, can't control the muscles to pee, numbness and tingling in the fingers and the feet. That could be anything. Sharp shooting electrical pains. Whenever you see electrical pains, that's likely Babesia. When people have electrical shock-like pains in the body that accompany skipped beats, tachycardia, shortness of breath, ear pain, tinnitus, gripping chest pain, calf cramping, occasional night sweats, severe anxiety, hair loss, bruises easily, nosebleeds, sharp pains in the chest, we are looking at Babesia, people. Muscle flaccidity. That could be anything, but commonly Babesia and bartonella. Energy is great until you go to use it. So this is very, very interesting. And the reason why I say this is interesting is because a lot of people have chronic fatigue syndrome. A lot of people just don't have energy and they have bugs, but they don't have malarial infections. Because people who have malarial infections, they feel fine. They don't really feel like they're being drawn upon until they go to use their energy. And then when they go to use their energy, they don't have energy, but they feel fine. They feel awake, they feel ready, they feel like they want to go exercise, ride their bike 10 miles. But when they go to get on their bike, they're just like, holy shit, I'm going to fall apart. And so that's a malarial type of infection for you. So malarial infections are different. Bartonella is different. Babesia is different. Malaria itself is different. So there are different types of malarial infections and they behave differently, but there are common symptoms associated with malarial type of infections. And those are many times tachycardia, shortness of breath, night sweats, calf cramping, chest cramping, and anxiety. And nightmares can be an issue as well. Dull, achy pains of the left chest, that could be anything. Internal vibrations, let me see, depression, that could be anything. And what I mean by anything, that means it could be any type of pathogen. Often can't feel what he's holding. I've seen that many times. Gets shaky, gets into fight or flight mode, congestion, burning eyes. Whenever we see burning, we consider a malarial infection, specifically Bartonella. So this patient is presenting as if he has a chronic Babesia and or Bartonella infection, not or, Babesia and Bartonella infection. We all have bugs. We have all categories of infections all the time, but we got to keep our bugs under control in order to feel good and feel vibrant, feel strong, and not have issues. Numbness and tingling in the face, head, and cheekbones, low back pain with sciatica daily. That could be anything, but a lot of times, this low back pain with sciatica, when accompanied with other malarial type of symptoms, I find that the malarial pathogen will cause the low back pain with sciatica if there's not some kind of structural thing going on. I've seen this a lot. And when the pathogen gets annihilated, then the low back pain with sciatica goes away. I had low back pain with sciatica. In fact, I had all of these symptoms except for the diarrhea episodes 13 times a day and maybe some of the other ones. This patient is probably the first patient who was worse than I was, except for I was hospitalized and almost lost my life 3 times. This patient didn't have any hospitalizations, as far as I'm aware of. So, at any rate, I had to be more careful than this person was. Doesn't have to be, but it could be burning pain in the groin and genitalia. Classic malarial type of infection. Burning pain, Bartonella. Bloating, 13 bowel movements on average per day with diarrhea every day. So this person has 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22 symptoms associated with the potential for a malarial type of infection. Bingo. Okay, so in my experience, malarial infections are easy to get under control. Sometimes they take time. It depends on people's genetics. Sometimes it happens immediately, like within 6 weeks, people will have a significant improvement, and sometimes it takes 3 months. I've seen people with this almost identical type of scenario where people will have a night and day shift in 6 weeks, and other people, like myself, it took 3 months to get out of the woods. Like I said, I think it just depends on the genetics. And people will say it also depends on detoxification. That's genetics. And the other thing is the first thing you want to do is you want to support detoxification. That's one of the number one things is number one, you don't want to feed the infection when you start going after it. Number two, you want to help detoxification. And I help people detox the same way. And some people, it takes longer than others. It could be because some people have a higher pathogenic load. It could be because some people have better genetics. I think it has to do with both. And there's probably more factors also. So, the diagnosis I gave this patient was multiple systemic infectious disease syndrome. This is called MSIDS. This was a diagnosis created by Dr. Richard Horowitz, who I had interviewed, a couple months ago or so. And Dr. Horowitz has tested over, I would say 10,000 people and categorized their symptoms based on their laboratory diagnostics. So, chronic infections and Lyme disease is not necessarily a laboratory diagnosis. It can be confirmed, and I say can be confirmed by laboratory testing. But disease and chronic infections many times are diagnosed clinically. So you can diagnose somebody with a chronic infection or MSIDS with a clinical presentation like this. Definitely a clinical presentation of multiple systemic infectious disease syndrome. This is not an autoimmune presentation with no known fucking cause, which most of the doctors out there will say that people have. They will put them on immune suppressants and then they will go downhill for the rest of their life, having multiple procedures, have all kinds of issues that will come up because chronic infections will cause issues. They will cause issues in just about every system of the body. And so people will go down the road with all kinds of procedures, all kinds of testing, all kinds of drugs, all kinds of everything. So what do? I diagnosed this gentleman with multiple systemic infectious disease syndrome. I asked this man what he wants. It's important to know what your patient wants. And he just, Patrick, I want to get better. I want my life back. And I said, hey, if you could put all of this behind you and do this under a year, would you do it? He was like, yeah. I said, okay, let's do this. He's okay. What do I do? I said, okay, we'll talk about it. So treatment. I had him starting out with dietary modifications. I have a dietary modifications where people don't feed the infection. Their dietary modifications are quite strict. Many times people will say my dietary modifications are more strict than any dietary modifications that they've seen anywhere. And that's probably true. And the reason why I know this is because I had to go through this myself. I was riding the ridge of life and death on a daily basis. The symptoms were caused by the immune system's response to the increased motility of the pathogen. You want to not feed the bugs. And when you don't feed, the bugs get tired and their motility slows down. And when their motility slows down, then you can slowly get on top of the infection. And also, when the motility slows down, then your symptoms start to not necessarily resolve. Sometimes they do, but they mellow out. And then the immune system is not hyper functioning all the time. And then people start to feel better when you don't feed the bugs. And so dietary modifications was number one. I had this gentleman start doing the dietary modifications for 7 days while including 200 milligrams of S-acetylglutathione twice per day. So this is a low dose of S-acetylglutathione. And the reason why I had him on a low dose is because with Babesia and Mycoplasma and sometimes bartonella, people can have too much detox too fast, and it can cause an increase of symptoms. It can make people uncomfortable. So I wanted to go in gently. I wanted to not feed the bugs, help bring his symptoms down by not feeding the bugs with the dietary modifications, start him out with 200 milligrams of S-acetylglutathione twice per day. S-acetylglutathione is about 90% better and more effective than liposomal glutathione. It's more expensive, but it's better. It's all I use. I don't even mess with anything else. And then after a week of doing the dietary modifications and the acetyl glutathione by opening up the detox pathways, then I started him on SpiroClear 1 that goes after most categories of infections. It's a very aggressive formula. I started him out at a half of a capsule a day, and I worked him up to a full dose of 5 capsules twice per day. And then he included Intracell 1, which is really the formula, or not the formula, but it's a formula that's going to be even more aggressive against Babesia and Bartonella. And the reason why I have people take Intracell 1 after SpiroClear 1 is because SpiroClear 1, it starts to clean up the plasma. It starts to clean up the bugs in the plasma and the digestive tract, and it helps to resolve bad bacteria in the digestion, in the small intestine, in the stomach, in different areas of the digestive tract and in the plasma of the blood. And yes, it will go after Babesia, Bartonella, malarial type of infections, but it will not penetrate the red blood cells. Babesia and Bartonella like to get into the red blood cells, and they will hide there. They will consume our iron, oxygen, and hemoglobin in the red blood cells, and SpiroClear 1 won't get in there. But Intracell 1 will. If people take SpiroClear 1 and Intracell 1 at the same time to begin, they will have too much die off. And so that's why we start slow with SpiroClear 1 and we start working on the digestion, start working on the plasma. And then when people tolerate a full dose of SpiroClear 1 without having excess die off, then we start them on Intracell 1, we include Intracell 1, and then Intracell 1 has a nice dose of artemisinin in there, which will help penetrate the red blood cells and kill the pathogen in the red blood cells. And then when this happens, then you have a full spectrum antimicrobial that goes after all categories of pathogens, including penetrating the red blood cells to help kill off malarial type of infections and protozoa and parasitic infections that get into the red blood cells. And when that happens, people will have a decrease of malarial type of symptoms, which is basically everything. Some of the more severe type of malarial type of symptoms are the tachycardia, shortness of breath, anxiety, sleep disorders, sharp shooting electrical like pains, night sweats, can be low back pain with sciatica, and burning pains in different areas of the body. So burning pain in the eyes is common with Bartonella. Burning pain in the genitalia and the groin is common with Bartonella. Muscle flaccidity is common with Babesia and or Bartonella. Episodic tachycardia and arrhythmias common with Babesia and Bartonella. So when people start taking that Intracell formula, then those malarial infections really start to drop pretty quickly. This is this patient's presentation. So I like to meet up with people after 5 weeks after they start their first dose of their herbs. So we're going to look at this patient's check-in, at 5 week check-in. And so their 5 week check-in was February 9th. So the yellow indicates improvement. This is the 5 week check-in, February 9th. The patient began this protocol on January 12th. So if we do a quick scroll, the yellow, I think that's yellow, I'm colorblind, but the yellow indicates improvement. Gray indicates no improvement. So we'll just do a quick scroll here and we see tons and tons of improvement. So when we first checked in, this gentleman said that his clarity has improved. He's more mentally awake. He can see and notice and recall things that he has not been able to in a long time. This is 5 weeks after beginning treatment. He couldn't recall making a plan even after 2 minutes, but he can now. His physical symptoms have receded quite a bit. He had been juicing celery, cucumber, and greens a couple times a day. He cut his antidepressant in half 3 weeks prior. He seemed to be doing okay with it. I did tell him to work with his doctor if he's going to cut any of his medications. He used to defecate himself when he thought that he had to pee, he had to urinate, and he hadn't been doing that anymore. He did black out. A new thing that came up for him was he started blacking out when he was driving. And so I told him, and I told him to write it down, and I saw him write it down. I said, do not drive anymore until this symptom passes. And I told him to put this note on his refrigerator and just basically told him, I said, don't drive. And until this passes, until this does not happen anymore. So I educated him to continue treatment, and I recommended that he increase the S-acetylglutathione by 100 milligrams twice per day. So he's going from 400 milligrams to 600 milligrams twice per day. This is still a pretty low dose for what I like to do, but I'm being cautious with Babesia because I don't want him detoxing too fast and get uncomfortable. Right now, things are looking pretty darn good. He's going to be rotating to Intracell 2 to offset microbial resistance, specifically to the malarial type of infection here in the next, probably few weeks or so. I told him to reach out by email or text anytime. So all my patients who have MSIDs, who are on a protocol like this, I tell them, I say, hey, look, text me anytime you want with any questions. Text me if you're having a problem. Text me if you have a question regarding a food to see if you can eat it or not. Just shoot me a text. And the reason why is because in 5 weeks, I want to see you better. I want to see you better in 5 weeks. And if you do one thing, if you start drinking licorice root tea, you're not going to get better 5 weeks down the road. So I want to know if you're making any changes to your supplements, to your medications, or to your dietary modifications so I can help you make sure that you are going to get better within 5 weeks. So let's look at his check-in. So 25% improvement with his memory. So February 9th, he reported that his memory has improved big time. He still has confusion, 25% improvement. That's pretty darn good in 5 weeks. He forgot to breathe much better. He had an ongoing headache. It was gone since the third day of his diet. So this person had an ongoing headache and it has been gone since the third day of the dietary modifications. The metal grinding sound, it happened twice in the last month instead of having it every day. The dome feeling over his head was less. The hearing loss seemed to be changing. The color vision that goes from seeing color to black and white was gone. The thick saliva, it's not thick most of the time. That had improved. Dry heaving was gone. He went from dry heaving 3 to 6 times per week to not having it at all. Sharp pains in the chest became mild. Shards of glass sensations in the body, Babesia symptom, zero. Feels like his body was on fire, didn't have that anymore. Body temperature didn't regulate as it should, was improved. Diarrhea, 15, 10 to 15 episodes daily. He only had that twice within the past 5 weeks. He went from having 10 to 15 episodes of orange and green and different colored diarrhea per day to having two bowel movements per day and had 2 episodes of diarrhea. He has a good appetite now. Has immediate nausea after drinking water, happened twice within the last month and it was gone. Bladder is killing him. Initially, no pain now within the last 5 weeks. The symptom of grabbing a sandwich and biting his head instead of the sandwich, it was not a thing. His neck still crunches, but significantly better. Nosebleeds, gone. Bruises easily, improved. Coordination, improved. Hair loss. His hair seemed to be growing. I didn't expect to hear that. And I almost didn't ask him, but he mentioned that his fingernails were looking better and his hair seemed to be growing. This patient has good genes and he's detoxing very well. And he's getting his symptoms under control pretty quickly. You can have a patient like this, or you can have a patient where it takes 3 months to get like this. Severe anxiety, huge reduction. Occasional drenching night sweats, none. Cramping in the calves, And sore muscles everywhere? None. Tightness in the gripping pain in the chest? He has more tightness in the chest now. It's more minor. Ear pain, tinnitus? Less. Shortness of breath? Less frequent. Difficulty swallowing? None. Acid reflux? He's not taking Pepsid, and the acid reflux seems to be gone. Episodic tachycardia? Gone. Arrhythmias, skipped beats? Less, but still there. Pain between the shoulder blades? Gone. Underneath the ribs and backsides on both sides? Gone. Serious pain in the abdomen? Gone. Tingling and limbs falling asleep? It's way less, but he still gets it. His fingertips to the elbows and knee and whole head. Short-lived, but he still seems to have that. Slow urinary flow? Improved. Cannot control muscles to pee? Improved. When he feels he needs to urinate, but nothing comes out, and then he defecates himself? Gone. Numbness and tingling in the feet and the fingers? Less frequent, doesn't last long. Sharp shooting electrical like pains? Zero. Hat head symptom? 50% better. Quick muscle flaccidity? Improved. He can do more. He's more functional. Energy is great and still until he starts to use it. So this patient did not have very much energy, and now he's able to get around, move around all day long, and then he tanks at the end of the day. So he's functional all day now. Dull achy pains over the left chest? None. Center chest stabbing pain with minor anxiety. Check in. There's an improvement there. It seems a little gray in terms of my notes. I need to check in on that next time. Internal vibrations, mostly with anxiety. His sleep is much better. He seems to get 6 to 8 hours of sleep. He is sleeping through the night. His depression is significantly less. He has more soreness rather than pain on the bottom of the feet, more soreness on the hands rather than pain. Not being able to feel what he is holding is gone. He can feel what he's holding now. He couldn't feel his fingers touching each other. He can now. He gets intermittent hives, has not had any. Shakiness is gone, gets into fight or flight mode. In the past month, there was about 3 or 4 times. Congestion is better. Burning in the eyes has improved. Numbness and tingling in the face, head, and cheekbones, gone in the face and the cheekbones, a little bit in the head still. Low back pain with sciatica, better. Burning pain of the groin and genitalia, gone. Bloating, almost gone. 13 bowel movements on average per day. 2 one-to-solid bowel movements now, every day, with 2 episodes of diarrhea over the last 5 weeks, after 5 years. This is medicine, ladies and gentlemen. This is how you practice medicine, okay? When people come in and they tell you that they have short-term memory loss and their memory has been shot since COVID, and they have anxiety, and you ask them what else they have, and they list a few symptoms, you don't just walk away and give them a diagnosis with back pain, neck pain, anxiety, shortness of breath, and memory loss. You start digging and you find out what else is going on. Most of these symptoms, I had to ask him if he had these symptoms right here. I had to ask. He reported to having about probably 6 or 7 symptoms. And then I went down my list from head to toe, inside and out, to see what else was going on with him. And this is what I found. I found 75, approximately 75 symptoms, and they were severe. Doctors don't do this very much. They might give somebody a handout. Oh, check these boxes via this and this. And then the doctor comes in, talks to you for 10 minutes at best, maybe 15 if they don't have anything else to do. But generally, it's about 5 minutes. And then they prescribe you some medications and some testing to test for this, that, or the other thing. This is a classic case of MSIDS. This is a classic case of autoimmune disease that people would normally start taking all kinds of medications for. The doctor would probably prescribe immune suppressants for the immune reactions. They would probably prescribe some sort of cardiovascular medications for AFib. They would probably prescribe antidepressants, anti-anxiety medications, and probably more. And there would probably be some blood work involved, which is not a bad idea, and some other testing. Then the patient would continue to go down the road, and the patient has continued to go down this road of suffering for the last 5 years. This patient has seen many doctors, and none of them have been able to help this person. Finally, this patient came to me because he heard of me and heard what I can do. He's pretty grateful that he's on the way of getting better. He's going to be able to put all of this behind him forever. And the reason why I say forever is because I educate people how to prevent this from happening again. And if it does happen again, he knows what to do. So he's going to be smarter than most doctors when he's done with this. Yeah, pretty cool. So, at any rate, this patient, he's doing great. 5 weeks, he's quite a bit better. And some people, it's either people get better this fast or it takes them 3 months. And I think it's based on pathogenic load and genetics. It's still going to take them the same amount of time to get through this, most likely. It's still going to take them a full 10 months to put this behind them. And I've had people stop at 8 months and they're still good. But I like to put a guarantee on board to where, hey, this ain't coming back. And this is what to do to prevent it. And that takes a good 10 months. At any rate, that's all for that. And just wanted to give you an idea of, somebody who presents with severe symptoms, what I do, how I treat people, how I feel doctors should be treating people. I gave this person initially 2 hours of my time to find out what was going on with them. I charged $200 an hour. This patient paid me 400 bucks to devise a diagnosis and a treatment protocol. And then he probably spent a good, $150 on his first supplements and his herbs and for his first month. So his first month, 5 weeks, he put out about $550 to have this much improvement. I think that's pretty good. Insurance doesn't necessarily pay for my service, and that's unfortunate. But if insurance did pay for my service, do you think that insurance companies would be saving money for paying for herbs and supplements for people that would get them completely well rather than paying for expensive medications and procedures and surgical procedures as they go downhill for the rest of their life? Absolutely. Do you know how much it's going to cost to take this person from debilitating illness back to health? Under $10,000. It'll probably cost him about 6 or 7 grand, and then he'll be good to go. And insurance companies are paying hundreds of thousands of dollars on people who are sick, if not more. So, at any rate, people, there you have it. And if you have chronic illness and you want some help, check me out. All right. God bless. Take good care.